Hey guys, so today we're going to be talking about compression devices. So there's three main types of compression devices. We're mainly going to be talking about ACE bandage and TED hose, but I do want to quickly touch on sequential compression, which is a type of compression that basically plugs in to the wall and pumps air to create the compression needed on a specific limb. You're more so going to see that in the hospital or in a more higher care facility because those are very expensive and high tech. So we're not really going to see those in long-term care facility, which is why we don't talk about them in this video. So common uses for TED hose, or sorry, for compression devices is edema, clot risks, which clot risks are anybody who maybe just got out of surgery, has a broken bone, isn't ambulating, isn't getting that circulation that they need throughout the whole body. And then there's varicose veins, which, if you don't know what that is, a lot of people who work on their feet, like hairdressers or nurses, have a high chance of getting varicose veins, which is why you might see some nurses wear compression socks, which is just a preventative measure. And then venous insufficiency. So, again, not good circulation. So I quickly want to touch on what compression devices do. They basically put pressure on the veins, pushing the blood back to where it needs to go into the central circulation, promoting better circulation of the body. Okay, so prior to putting on a compression device, you're going to want to assess for edema and make note of what it's at so that we have a baseline measure. You're going to want to check for if there's any bruising. If there is, we probably are going to want to check with the provider before putting on that compression device or assess the bruise and understand its origin or where it's coming from. If there's skin tears, we aren't going to want to put a compression device on because it's so tight that it could easily slide against the tear and make it bigger. If there's an open wound, we also don't want to put on a compression device just because that's just not safe. You never want to put compression on an open wound, and also it creates a chance for bacteria and infection. Now, while you're using the compression device, you will see that you're going to want to make assessments either through the toes or the open foot, which the toes is going to be for the TED hose or the open foot with an ACE bandage, which you guys will see further along in the video. But you're going to want to check the skin color. Is it pale? Is it warm? And assess, okay, how is this working with circulation? The temperature, is the skin warm? Is it still getting circulated? Cap refill, again, circulation. And then sensation. Can the patient feel the toes? Are they tingly? How are they feeling? Are they in pain? If they are, something's wrong and the compression device isn't working in the way that we want it to. All right, so we're first going to watch the ACE bandage video.
So the ACE bandage is another form of compression device that we can use, and before we would apply it, we would of course do all of our assessments of the lower limb. It is used for edema as well as with the TED hose, and really which device that you're choosing depends on the doctor's orders and patient preference. So we would do our skin assessment first, and we would be assessing for abrasions, open wounds, edema, rashes, any sort of bruises or sores. And then when we're applying the ACE bandage, you want to keep it wrapped, and you want to wrap it in a spiral from the bottom up because we're trying to push the edema back up to the central circulation. Now, there are different types of ACE bandages. Some of them are just standalone. Some of them do come with this clip, which this actually is a risk for risk for injury both to you and the patient because it has these teeth on here that easily poke through and can poke the patient or you or yourself. So you want to be extra careful if you're going to have to use this. There are other versions of the ACE bandage that have a Velcro strip on this, on the ends of it, so you can just Velcro it onto it, and that reduces the risk for injury to both you and the patient. Third alternative would be to use some sort of stretchy medical tape to be able to secure it into place.
Okay, so something I really liked about the ACE bandage video is how Skylar talked about the method of wrapping from the bottom to the top is showing us that we're pushing the blood flow back into central circulation. If you keep that goal in mind, applying a compression device is going to be so much easier because you're going to understand how this is working and what you need to do to ensure that it's working. Keep in mind that the clip and the Velcro could be a risk for tearing in older adults' skin. Okay, and then here are our videos on the TED hose.
Okay, so this generally is what our TED hose is going to look like on your patient's leg. You want to make sure that all of their toes are in this little flexible, a little bit thinner and not as tight little toe box up here, so they're not cutting off full circulation to their toes. And ideally there's going to be no wrinkles all the way up the leg, so you can kind of see around the back there's no wrinkles either. On Juno it's going to be a little bit different just because she's got some little joints in here that it's going to get caught in, so we can't get all the wrinkles out. Okay, so one of the big reasons you want to make sure there are no wrinkles is because it can cause skin breakdown and it can kind of cut up their skin. It can also be really uncomfortable for the patient themselves. And when you're getting wrinkles out, ideally you want to go from underneath the actual TED hose. And you kind of want to do that as you're working up and putting the TED hose on completely. There's also a few different types of TED hose. So there's some that kind of end right around their knee. This one goes all the way up, so you can kind of see that there's like a little grippy section that holds it all the way up to their thigh. So that's another thing that you want to make sure when you're picking out the correct size. So when you're about ready to put your TED hose on your patient, you want to do the same skin assessments that you would do for the elastic bandage and check for any abrasions, bruising, edema, all of the above. And you're going to start with your TED hose actually like flipped inside out kind of and like over itself. And you want to pull it apart. They're a little bit tight, but you want to pull it as far as you can, kind of keeping that toe box out so that it's easier to slip it right over the patient's toe. And then go ahead and stretch it over. And you want to do it as best as you can in one smooth motion and not like snap it on the patient's leg. So on an actual patient, putting on the TED hose will be a little bit smoother than it was just then. On the Juno, it's a little bit more complicated because their leg is like bending around and there's little like bolts to go around. But with a real patient, their leg's gonna be a little bit stiffer and it's gonna be a little easier to just slide it right up.
It's important to remember that TED hose are one per patient, meaning that they don't share, and typically patients will have two pairs just in case one gets soiled. You'll wash them and then use the other pair.
So when picking out TED hoses, it's important to look at the back, at the chart here. It has calf circumference and leg length. And each of these correlate with which size you should choose for your patient. And if you pick out the wrong size, if it's too small, it can cut off circulation, which will harm the patient. And if you pick out a size that's too large, it'll be ineffective because it won't be a compression device.
All right, so one thing I want to mention about the TED hose is if our video of us sliding the TED hose on the Juno was not enough for you and you do not understand how to put the TED hose on, go look up on YouTube TED hose application. It's going to be very clear on how to put it on. It's just so much harder on the mannequin than it is on on a human. And I also want to say the more you do it, the more you're going to understand how to put TED hose on, and it's going to become a lot easier and just part of your everyday practice in a long-term care facility. And then the chart on the back of the TED hose is so important because this is an ABC issue you're working with. You want to make sure that size is correct to promote the correct circulation. You don't want to be cutting off circulation or getting a too small of a size where you aren't even doing anything to the circulation. Okay, so thinking of patient safety, we want to be paying attention to the risks that compression devices can cause, especially in older adults, which is what this slide is kind of focusing on. You are going to have a high fall risk. This is because the compression devices are slick. They don't have that grippy bottom that like regular grippy socks do. So if a patient stands up, they are at a high risk for slipping and falling. So before you leave the patient's room, think about safety and put that bed alarm on. Tell them to call if they want to get up, paying attention to how you can make it a more safe environment for them. The attachment style on the ACE bandage is a risk, again, for tearing the skin, like we mentioned. And then size is a huge risk because we want to be promoting the correct circulation. So really pay attention. If you don't understand how to pick out the size for your patient, go back to the video of Brenna showing the back of the size chart and pause and maybe read it, because you're going to see a column for the circumference, a column for length that correlates to each size. So reading it and understanding it can help you understand why the size is so important. Yeah. Also remember with size that it is going to change, like that chart is going to change depending on manufacturer. So always make sure to look at it for each patient. All right, compression device removal. So you aren't necessarily going to have like a specific time that you have to remove the TED hose. You might, but in most instances, you aren't going to. So these are just like some general rules of thumb when it comes to removing compression devices. They're typically removed at night. Now, again, in high intensity situations, that might change. And this is mostly referring to a long-term care facility. So pay attention to your facilities, rules and regulations, and also the order in the MAR. It might mention, how long the doctor or the provider wants the compression device on. If the patient complains of pain or tingliness, then there's something wrong and we need to remove the TED hose. And then a rule of thumb that our book mentioned is every 8 hours for at least 30 minutes. Again, this might change depending on facility, so don't like use this as gold. It depends on the situation. All right, and then other nursing considerations. Compression devices can be delegated to a CNA. So you could tell a CNA to put the compression device on a resident or a patient. Just understand that this is an ABC issue with circulation. So think, is that something you trust the CNA to do? If it is, then go ahead and do it. If not, you can do it yourself. If there is some sort of assessment that seems questionable, then you need to go in and check on the patient and check the circulation. And then making sure to do patient education. So most people aren't going to want a really tight device on them that's not comfortable. And so educating the patient on why you're doing this can really help them be cooperative and allow you to put the device on. Teaching them how to use it, teaching them to call if they want to get up since they are at a fall risk, when to take them off. And then when I say what to assess for, I mean, make sure to tell them to call you if they're feeling pain, if they're feeling tingly, things like that. Tell them what to call you for. And then I wrote family member on here because if you're working in a facility where it's not long-term care, maybe it's a rehab center and this patient's gonna go home, it's so hard to put compression devices on yourself, especially an older adult. So if there's a family member, a caretaker, a loved one, someone who's going to be with them, teach them how to put on the compression device so that they can help the patient and put them on at home. Make sure to do teach back with that because this is a circulation thing. It's so important that they understand the correct way to do everything. And then here are references. So we really only used the textbook, as you can see. And then I do want to mention that our slide template is from SlidesGo. Thank you guys.